LA County's public health system is headed toward a financial crisis. It is losing hundreds of millions of dollars each year after funding cuts by the Trump administration.
Yeah, to talk about what this means for patients, Dr. Anish Mahajan is the CEO and Chief Medical Officer at Harbor UCLA Medical Center, and he's joining us to discuss this. Thank you for being with us this morning.
Thank you.
We're talking about hundreds of millions of dollars, so cuts that would severely impact the county's Department of Health Services, which oversees 4 public hospitals, including yours, and roughly 24 clinics. So talk about how this is going to affect patients. What are they going to see?
Yes, thank you. We are seeing major cuts in 2 big ways. One, to public health services, and public health services from the county serve everyone. For example, in public health, we make sure that the food is safe when you go to a restaurant. We make sure the beach water is safe. We do a lot of services related to preventing the disease outbreak and response. You've heard about measles. There's a large measles outbreak that we're tracking in other states around the country. And measles, as you know, is one of the most contagious viruses out there. And somebody, measles, the virus can stay in a room for many hours. And so people who come into contact with that room are at risk for measles. And in public health, what we do is we go and find folks who may have been exposed in that room and make sure that we give them public health guidance and ensure that they're getting the treatment they may need and the protection they may need. And so like a single case of measles here in LA County resulted in our department needing to find 600 people who were exposed and monitor them and make sure that they're safe. That's an example of public health services that are facing major funding cuts with the bill. Another major place, as you point out, is the cuts to Medicaid. The new law that the president and Congress signed results in over $1 trillion estimated to be cut from Medicaid insurance, known as Medi-Cal here in California. Medi-Cal insurance gives coverage to people who are low income, elderly, and disabled. And there's almost 40% of Angelenos are on Medi-Cal. And so we are really worried about their ability to maintain their insurance. Many people will lose their insurance and they won't have the ability to go see their doctor. And this could result in major overcrowding of our emergency rooms, which of course are already quite crowded.
Yeah, so I have a follow-up question to Medicaid. I mean, we know, for instance, 40% of Medicaid users are children, so people who maybe are particularly vulnerable. So if they lose their coverage and they're a lower income family, what do they do, where do they go, and who treats them?
Yeah, it's a very big challenge. And so, right now it's too soon to say. We're waiting for further guidance from the federal government about how this will all play out. But we know that families are really worried about their ability to go to their usual sources of care, the places where they usually go, their federally qualified health centers, their clinics in their communities, their clinics at the County Department of Health Services. And so there's a lot of concern.
Absolutely. Are there any ways possibly to fill in the gaps? Could funding come from somewhere else?
Well, we are, working very closely with the governor and the state, as well as with the County Board of Supervisors. We are grateful to our county board who are working with us closely on identifying strategies that we can maintain services as best we can in light of these cuts.
Dr. Mahajan, thank you so much for joining us this morning.
Thank you.
All right, really scary to hear those numbers and what could be coming up. We'll continue to monitor that situation.